because of my clinic experience and one parameter I took from a Cavo machine, Cavo key. It's another laser machine, but it works very good. And with this mode, I tried to work with mine, and I like it because it's very, very fast, taking off the large amounts of tissue, but with some side effects I'll show you later. So for first group, in the test groups, I took 12 Hertz with 500 millijoules of energy with this 6 watts, and it's closest to the average power we use every day with the MSP mode to remove enamel in the beginning of preparation when we have to open the carious lesion or we have to remove some old filling. And you know, when you look at your machine and you see 6 watts or 9 watts or 20 watts, this is determining the maximum speed of what you're doing. But what kind of preparation you do, it depends on the peak power. So this energy of the pulse is more important for your effectivity. It depends on if you are in cold ablation regime or you got warming the tissues. So we need to use a little bit higher energies to be sure that we are working in cool condition and safe. So for the second group, I decided to use the same energy like in MSP mode, because before I work in MSP mode, which is very nice and clear, and every day you can use it for normal caries removal. If you in normal conditions, you can use it. You will see in the first control group this mode. So 15 Hertz here are equal to 75 Hertz because of QSP mode, and in the first group are equal to 60 Hertz. Usually your machine have 50 Hertz because of time relaxation of the electrons, which electrons when falling down are emitting the photon, and this is a limitation of erbium YAG crystal. That's why BioLace did erbium chromium. The chromium makes the crystal works faster, but it changes the wavelength, and we have 3 times less absorption in water, so it's less effective. About the third group, I added to this 15 Hertz 300 millijoule, I added etching procedure for surface modification. I wanted to see the difference in with MSP in surface modification. That's why I didn't lower the Hertz rate, and I decided to do it on 50 Hertz, real 50 Hertz, and 120 millijoule. It's 10 Hertz, but it's QSP. And normally, you know, you use, I will use a highlighter here. This is the classical etching procedure for surface modification, and I decided in QSP to use the same, but to work faster with the handpiece. Of course, it took me some training, few weeks, to see how it looks with my lenses, and but this was in vitro on again on a bovine teeth before I decided which mode to use and to do this experiment. So for the first control, I used on your LightWalker. If you touch the screen and you go in the hard tissue folder, you will see enamel preparation mode. So this is 30 Hertz, 300 millijoule, which you can use every day for beginning your preparation. It's very safe, it's very fast, it's a little bit more noisy than the QSP, but it's working very well. And of course, because it's proven that surface modification procedure after preparation works very well, and you have to do it every time on your cavity preparation to make sure that on the borders you have a smooth surface for good adhesion. So for surface modification, it's the key of successful restoration because it seals the cavity very well. And because the QSP is more sharp and well-defined borders of the preparation, I decided to do it because sometimes you go extra outside the borders of the preparation and we etch enamel which is sound. So I want to avoid this, and I want to introduce the etching with QSP mode. So that was the aim of my study. And the second control group, which actually is fifth group of my experiment, is with a high-speed drill, with a cavo drill, which is 90 watts. I'll show you next. Just a second. Okay. So in one day we prepared 150 teeth. We kept them in a saline solution, and we used Voco from Germany, nano hybrid composite, Grandioso, and the 7th generation bond, one bottle self-etching bond, Futura bond. And we did 30 teeth from each group, but for micro leakage test we took 15 teeth from each group, and after cleaning the pulp chamber we fill it with the silicone, with the adding additional curing silicone, usually used for impression taking. And we give it to the microbiology department for thermocycling and subsequent coloration with the methylene blue. And you will see the groups now and the results. Why we use bovine teeth is why they are similar to human enamel, and it's possible to work on the same substrate, same tissues. Also you will see there is difference in the groups, but they are with almost same age and same food. They're grown in same conditions. So there is no big divergence like in human teeth, because when you collect some extracted teeth you need one age, but it's not possible every time to have teeth for 40 years old persons, about hundreds of teeth. It's very hard to collect. I used my Photona model year 2011 with the focusing tip handpiece, non-contact. The focus is 1 centimeter, and in 1 centimeter you have 0.6 millimeter of diameter of the spot. So these are the groups shot. You will see how they are prepared. These are 15 filled with the silicone. You see the pink color. This is a freshly erupted incisor. This is old, this is old, this is also old. This is a premolars. So you can see here the premolar again, but these are for bacterial contamination, so they are not still prepared at all. We left them without silicone after cutting. This picture is taken during the experiment, so they are not ready in one day. You see the second group. I will pass faster through the groups. In every group we have equal quantity of old incisors. The most of all are old incisors. some fresh incisors, about 6, 3 here.